Health leaders say August is the most popular birth month, followed closely by September. And with that said, the number of new moms struggling with postpartum depression is likely higher now than any other time of the year.
WKYT's Mariah Congito talked with the Chief Medical Officer for United Healthcare of Kentucky about maternal health challenges and how moms can get help.
While pregnancy and childbirth can be a time of joy for most people, it's important to recognize that it's not the case for everyone.
Dr. Gary Grossell, CMO of United Healthcare of Kentucky and an OBGYN, says 1 in 5 new moms experience postpartum depression.
20% of those will face suicidal thoughts or even attempt at self-harm.
While there's no definitive answer as to what causes PPD, Dr. Grossell says one of the main factors that contributes to it is a rapid decrease in hormones after pregnancy.
Mental health conditions are among the most common complications in pregnancy.
Dr. Grossell says he's had patients who've went into psychosis postpartum, and when they recovered, they had no recollection of that time. He says PPD can start within days of giving birth.
And can present in many different ways. Some women feel unable or unwilling to take care of themselves or their baby, while others may have negative thoughts even towards the baby.
He says in some cases moms can seek help through therapy, but in severe cases, the first ever pill for postpartum depression, Zurzuvae, can be a great treatment option.
The Skylark study is the main study that was done on it, showed that it worked within 3 days. Most of the antidepressants take a while for those to work. So within 3 days is a great thing to see. And it is working well with patients.
Dr. Grossell says you take it for 14 days and it'll last for another 4 weeks. He says the postpartum depression period usually lasts for 6 weeks.
Maybe as you're getting towards, closer to your due date and you're going to be delivering soon, is looking in some of the options you have.
He says it's also important for moms to know it's okay to ask for help and for families to reserve judgment during this time.
Just say, number one, I'm here for you. What can I do for you to help you? You seem a little different from how you normally are. Talk to me about it. Open-ended questions.
Mariah Congito, WKYT.